Hello, friends. Welcome to the Wellbeing Show with your host, Reshmi. We are back again with our series on menopause caused diseases. As promised in the last episode, we will talk about osteoporosis today. So, with us, we have my friend, my our doctor, Dr. Maureen Tigga, who is going to again highlight and talk a lot about what is osteoporosis and how to treat it and what are the symptoms and so on. So, without wasting much time, hi Maureen, how are you?
Hi Reshmi, I'm good.
Great, great. So, let's start with the very first question. So, in layman language, what is osteoporosis?
Well, today we have picked up a very important topic, Reshmi, that is osteoporosis. And in layman, we can break the term into two parts. One is osteo, which means bone, and the other part is porosis, which means that the bone becomes porous, like a honeycomb, and it is simply the weakening of the bones due to the process of menopause. And here I would like to share with our audience that menopause has a gamut of syndromes, or you can say there is something known as a musculoskeletal syndrome, which is an umbrella term used for a group of diseases which a lady develops. And that includes osteoporosis, that is thinning and weakening of the bones, sarcopenia, that is your muscle mass, it weans off and the muscle loss is there, and also the joints are affected, that is osteoarthritis, and of course the ligaments and cartilage. So the entire musculoskeletal system goes for a run, and there is a toll on it. And that is why today we have picked up very rightly this crucial topic of osteoporosis, which is very commonly found in menopause women. Having said that, why we are addressing this is because we have the problem statement is huge. The numbers are alarming and burgeoning. For example, I'll tell you that there will be around 70% of the women who have attained menopause, and they will suffer from osteoporosis within the first 5 years. And out of this 70%, 20% of them will have severe osteoporosis, not just weakening of bones. Severe means it can be clubbed with maybe a fracture, and that will disrupt the day to day activity. That will really take your independence, your movement, your locomotion. So that is why it is important. And another thing I want to highlight over here is that when it comes to the gender bias, if you compare osteoporosis in women, why are we highlighting this as for the women? If you compare women versus men at the age of 50, after the age of 50, there will be 50% of the women who will suffer from osteoporosis versus 20% in men who have crossed 50. So there is a stark disparity between the numbers, and the individuals who will be associated with osteoporosis is far more in the female population. And that is why we are here to talk about it.
Okay, okay. But Maureen, tell me, since we are digging deep into menopause-caused osteoporosis, is this how different is this osteoporosis from a normal osteoporosis that occurs in a man or yeah,
Yeah,
someone
Rishma,
who's
you have put up a very important question. Just like I said, that you can see the difference, the patient load in the two gender. How is menopause associated osteoporosis important, and why is we are so much concerned is, and it is different from the general osteoporosis, that it happens due to the depletion of estrogen. So there is accelerated bone loss. Also, it is superimposed with the fact that there is aging factors. So both of these, that is loss of estrogen as well as the aging factors, that causes a heightened effect on the women's bone, and there will be a loss of bone in a very fast pace versus the one which is generalized osteoporosis. So in generalized osteoporosis, you will find people are suffering from weak bones because of some dietary factors, or sedentary lifestyle, or maybe if they're on certain drugs which affect the absorption of calcium, like say if you're on steroids, that may lead to weakening of bones. But the loss of bone in these conditions, that is in the general osteoporosis, is not as heightened or as accelerated as that of a woman. As I said, that 70% of the women who have crossed 5 years post menopause will land up in osteoporosis. There's no way that you can because it's the physiology that is related. So that is the main difference.
Okay.
The volume of people affected and the rate in which it happens is far more alarming.
Mm-hmm. Okay. Um, Now tell me how the daily function of a woman is hindered by osteoporosis.
Well, the daily function of a woman is hindered by the very loss of your independence. That is, your motion is hindered. You have to depend on somebody to move around or even do your daily chores, like taking an over the height if you're trying to do a overhead outreaching of maybe an object from the shelf, or you're trying to bend pick up something from the floor. So these are normally a person does these activities, but because of osteoporosis, your the spinal system gets affected, your hip bone gets affected, so you're not able to move around, you lose your independence. So that also brings in that once you see yourself just declining and you see that you're not able to move independently, that also brings a effect on your mental health, because you feel that you are a liability now. So all these things are how a woman and then you are in constant bone pain, backache, you're not able to even relax properly. So even relaxation becomes a burden on you. So that is how the entire lifestyle is affected.
Right, right. Now tell me, are there measures that we can take right from childhood so that we can invest on our bones, you can say, and try to make it strong?
Yes, from childhood, what you can do is that good diet is what I always advocate, because what you are investing from your childhood, the benefits you're going to reap in the later days. In fact, studies have said that you achieve your peak bone density and your peak bone the architecture. It's a girl achieves it around 18. All right, and it furthers up till 30 that you're going to maintain that, and after that the decline starts because the hormonal changes occur. So if you're investing on your bones quite early in your life and you are giving your children that, it is definitely going to bring good results, and it is definitely going to you are going to reap the benefits of having a healthy body in the later in life. So in childhood, the first thing is your diet. It should be calcium rich, like milk. If you're intolerant to milk, you can take fermented milk in terms of yogurt. Then calcium rich food, as I said that recently, even vegetable like okra has a very good source of calcium. Vegetables give you even roughage, so that it takes care of your gut health, and even the absorption of calcium is good when you're taking a healthy diet. Then outdoor games, because we are now into a technologically advanced society where everything is at our palm. The games, your entertainment, everything is there right next to you. So the zeal, the zest which we had while going to parks, that have come down. So we have to encourage our children to go for outdoor games, and also sun exposure. That also brings in the sun exposure, which is very very important for your vitamin D. So weight bearing exercises which can be done outside, outdoor games, sun exposure, these are very important habits which we have to inculcate in our upcoming generation. And another thing which we have to address is that we are the generation who have seen how fast food they boom the market. So avoid the junk food. Everything is on the phone, that we try to order everything online. So we have to tell them that the junk food is not good, and incorporate healthy eating. Avoid colas, because colas and these caffeinated aerated drinks, they cause leaching of calcium from your bones and your teeth. So we have to educate them on that.
Rightly said. I mean, there are so many amazing, yeah, information that you just gave, Maureen. I'm wondering something. This is about investing on bones from childhood, but now at the age of 40, 50, do you think this is also an age where we can start working on our bones, or is it too late?
Well, as I always say, that there is a saying in our language in Hindi. They say that the moment you wake up, that is the dawning moment for you. Jab jago tab savera. It is never too late. You are not late until you are late and you have passed away. So those letters late is attached to your name once you have passed away. So when you are alive, you are still there, you are still functioning, and you are going to reap benefits no matter what you start, because your body is going to respond to any positive change you are taking at any given point of time. So I never discourage people that you have, okay, the time has passed, you did not do it in childhood, and now taking steps now, remedial steps now would not help. It would definitely help. So I would encourage that even if it is in 30s or 40s or late 50s, it's always better to inculcate good things in your diet and in your uh, your exercise regime that will help you to bring the positive results.
Right. Um, you just now mentioned about soda, right? That can weaken your bones. What about caffeine and alcohol?
Yes, same. Soda like caffeine is equivalent to soda. Even caffeine hampers the calcium absorption, and alcohol definitely. You should not take alcohol because it disrupts your gut lining and also affects the calcium absorption.
Mhm.
I think Reshmi, can we just take a break, 2 minute break? I'll be
Okay.
back.
Okay.
Yeah, you can just educate our audience about your experience in Scandinavia regarding sunshine, I think.
Right. Okay. Okay. So while Maureen is coming back, I would like to tell you that sunshine is a very, very important factor in life, and we have realized this importance after moving to Scandinavia. In India, I mean, there was so much abundance of sunlight that never thought how important it is. While childhood, growing up, sitting in the sun, playing in the sun was a habit, right? Because you always knew that there is sun. But when he came to when we came to Scandinavia, it was like for months from October it starts reducing. October, November is horrible, hardly any sun. December, hardly any sun. Then from January, February, little bit the duration of sunshine increases, maybe a few hours a day. So we are like without sun for 5 6 months, you can say, and that is when you feel so sad and depressed, and yeah, and so many other problems occur due to sunshine, due to lack of sunshine, I mean. So vitamin D is definitely is very important for your mental and physical health. So coming back to the next question, um, what are the signs of osteoporosis getting worse?
Yes, again, it is a very, very important question. Thank you, Reshmi, for this little breather I had to take. Yeah, the worsening signs would be that a person develops all of a sudden backache, or the backache which was already existing that worsens. All right. The second sign would be that there could be a loss in height. All right, loss in height means that women who it may not be that evident, it may be just 2 to 3 centimeter, but if when you actually correlate the symptoms, the person says that I have a backache, or if she goes for evaluation, there is a loss in the height. Now, why does that loss in height occur? This occurs because there is a fracture in the vertebral column. So your vertebral column that the which contributes to your height. So because there is a fracture, the woman faces a loss in height. So this is also another physical examination you will come to know. Then the other factors uh, which will tell that yes, there is worsening of osteopenia is that when you go for your bone scan, another there will be a range where you will feel where you will find that the bone structure has deteriorated, and the scores, that is the T scores which we measure in a DEXA scan, that reflects the osteoporotic range. And here I would just like to mention the to the audience that please don't worry. The good news here is that these bone scans are painless tests, so one can go through this, and it's easily available, and you do not have to suffer any pain or any prick. These are non-invasive tests, so it's always even in that old age you should not get scared. It is just a scan which is being done. And then there will be also fractures which will happen very easy, and these are known as fragility fractures. What is fragility fracture? Suppose you fall from a standing height. It's almost like so normal for any person to fall from a normal height. Like since childhood, we are facing that you just stand and you just lose your balance. So when you fracture yourself after falling from a standing height or even a height lesser than that, that means that your bones are weak. And these are known as fragility fractures, which occur due to even you can say low energy trauma. That is medically termed as low energy trauma. You did not suffer an accident to go for a to suffer a fracture. Fragility fracture is that your bones have readily become porous, so even a small touch, a small insult will amount to a fracture. And that is where the problem area arises. That is where, in during old age, we try to tell our population and educate them that your posture is very important. If you find yourself falling and being out of balance frequently, please go and get yourself evaluated, because your skeletal system is not supporting you, and probably you are just trying to think that you are just aging, but the problem is much bigger than what you are anticipating. So these are the signs of worsening
Okay.
osteoporosis.
And when it comes to treatment, of course, you mentioned diets and calcium, vitamin D, and all that. Along with that, bone density check, that's very important, right?
Yes,
And
yes,
then probably there might be some medicines and other stuffs which
yes.
the doctor will recommend.
Yes, so there are, of course, first of all, I'll tell you that there are medications that once you get yourself evaluated, you find that your in your DEXA scan, in your bone scan, if it is falling towards the osteoporotic range, or if you have a family history. Here, I would just like to again say and share that there are two risk factors, which one is for osteoporosis, one is modifiable, and the other one is non-modifiable. So the non-modifiable one is like your gender, your female gender, you can't change that, or a family history of fracture, you cannot change that. So these are the factors where we cannot work much upon it, but the factors where you can actually the modifiable ones, that is your diet, avoidance of smoking, alcohol, and taking healthy diet, and your calcium supplements, these are the factors which will help you to regain your bone density. So what I would like to say over here is that when we are treating you, and we find it in your family history that you have osteoporosis, or even not of the range of osteoporosis, but you can say osteopenia, which is not as bad, it's just the beginning part of your bone loss, and you have a family history of fracture or a history of fracture yourself, then we will start on treatment. And there are drugs which are like bisphosphonates. There are drugs like selective estrogen modulators, your teriparatide or denosumab. I don't want to go into the technicalities, but yes, there are drugs, and there are individualized, tailored approach which we see according to the patient's presentation. But the most important thing is that why wait for a fracture? We are here for preventive medicine. We are here to raise awareness that we should curb the problem before you confront it. So there lies the role of education and advice regarding your diet. So the first and foremost thing is that menopausal women need calcium in their diet, and the recommended calcium can be up to 1,000 to 2,000 milligram. And here I would just like to tell my audience that many a times we are 2,000 milligram tablets have to be spread across the day. That is 500 milligram calcium tablet. I know these are big tablets, difficult to swallow, but sometimes people find it very difficult to spread it through the day, so they will just gobble it in one go. But the problem is that if you take more than 500 milligram of calcium at one time, the absorption gets retarded. So it doesn't make much of sense. It's not helping you. So please stick to the regime as advised by your doctor. Do not gobble it all together to say that you are done and dusted for the day. Please take it as and when advised. Also, you should not exceed around more than 2.5 grams of calcium, that is 2,500 milligram of calcium in a day, that because it affects the absorption of other minerals. Then I also advise my patients that you have to be careful that you should not take more of sodium, because high sodium diet will again retard the absorption of your calcium. So please try and avoid too much of pickled stuff. Okay, the ones which are preserved, and always try to eat which is natural and fresh salads, because it provides you with roughage as well. Pickled, seasoned, and preserved food you should avoid. Then another thing is that you should not club your thyroid medications or steroid medications with intake of calcium. Avoid taking caffeine, coffee or tea, spinach, and antacids with calcium, because again, it will do no good. Now, another important thing, like you were talking about the sunshine, the importance of sunshine, that contributes to the vitamin D. So the recommended daily allowance for vitamin D for a woman is around 2,000 international units per day. But if you're living in a belt like where you are living, Reshmi, like the Scandinavian belt and all those the extremes of the hemispheres where you find that the sun is gone for months together, then there are supplements which are around of the strength like 60,000 international units of granules, or even injectables are available. So one can take that. And for that, what we do is that during summer we ask for one supplement, once a month supplementation. Sometimes in winter, especially, you know that how it is totally dark, then the doctor may advise you to take twice a month. So it will be tailored according to your needs. So vitamin D, sunshine exposure is very, very important. Another very important thing I would like to tell is vitamin K2. People don't talk much about it, but vitamin K27, it is very, very important. It is known as the traffic police of your calcium. It is the molecule which helps to direct calcium towards your bone. So the calcium goes and sits on your bone. So taking vitamin K along with vitamin D is very, very important, and it activates the osteocalcin which is present in the body, so that the calcium goes and fits itself into the bone architecture. So this is also a very important vitamin which I wanted to share with my audience.
Okay. All right. That's amazing. It was such important information that you just shared, Maureen. We all know that bone health is so important for daily livelihood, right? And to maintain that health. I hope the audience will implement these advice and suggestions which Maureen has just shared. Whether you are going through menopause or doesn't matters. This is something we should follow regularly, whether you are a man or a woman or a child. I mean, I think regular habit of taking care of bone through diet and exercise and other stuff should be a part of our habit. With that, thank you so much for today's episode, Maureen, and we
Yes,
will.
thank you, Rashmi. And another, before I sign off, I just wanted to add another point is that because we are dealing with a population which is aging, and this is a menopause associated osteoporosis, I would like to emphasize the importance of having a house which is friendly for our elderlies. Like they should have a well lit place. You should have grabs, hand grabs for which they can hold and walk around in the house. Comfortable footwear is very, very important. Comfortable wear, your overalls and how what the clothes which you are wearing is very important. Please do not wear something which would make you tend to fall, because you
Hmm.
have to emphasize it as a person who is
Right.
a dedicated, because many times we find history that they got stuck up in a very complicated dress, and that is the reason they fall. And you don't have to, as I said, that you don't have to fall from a height. From a standing height you fall, you're going to suffer fracture of your hip or your wrist or your arm. So these are the important things. We as caretakers, as family people, should ensure that when we are having such elderly people in our homes, we should make sure that their glasses, if the people who are wearing glasses, they are handy. It's a well lit room, it's a well lit area where they are living. The floors are dry, and we should be very helpful. Apart from all these, this is a very important health tip which I always tell my patients and my colleagues, that we try to treat everything by by way of a medication, but
Hmm.
these small things will really help
Hmm.
you prevent.
Hmm.
Sensitization for these things is also very, very important, Rashmi.
There are a lot of accidents that occur in the bathroom.
Yes,
Old
yes.
people, they
So that
fall
is why,
down.
the hand grabs and all, we have to make
Mm,
it a more friendly for our elderly population. The hand
correct.
grabs
Correct.
and
Yeah.
the support system should be there. Well lit bathrooms, well lit aisles should be there. The walkthroughs. So it is important for all those to prevent unnecessary fall.
Right. Right. That's wonderful. Wonderful talking to you again. And we will be back with another episode focusing on menopause associated diseases. Uh, Probably, uh, what was it called? Uh,
Yeah, as I said, the
sarcopenia.
musculoskeletal, yes, musculoskeletal syndrome of menopause. It had osteoporosis, which we discussed today. Then there is something known as the sarcopenia, where muscle loss occurs.
Mm,
So in that, we'll discuss about how to strengthen your muscles. I think
perfect.
that is an important area to be covered.
Okay. So with that, signing off from Reshmi, and hope to see you back in our next episode where we will be talking about sarcopenia. Thank you for your time. Thank you, Maureen.
Thank you.